so we are live, and today we're going to do a healthcare panel, and I'm going to turn it over to Alan Beck. Alan Beck is one of our board members, and he also chairs our healthcare council. It's a lot of C's to say.
It's a lot.
So I'm going to let you take it from here, and
All right.
go for it.
All right. Thanks, Lori. Again, yeah, I'm Alan Beck. I'm the Chief Executive Officer of Baylor Scott & White Orthopedic and Spine Hospital. And again, also chair of the Mansfield Chamber Healthcare Council. I'm very excited about that. Our Healthcare Council is a coalition led by healthcare leaders. And we're also recording.
Yes, we are.
But the coalition consists of our healthcare leaders in the community, Baylor Scott & White Orthopedic and Spine, Medical City Arlington, Methodist Mansfield, Texas Health Hospital Mansfield, are the leaders of the Healthcare Council. And the focus is around health in our community, collaboration where we can help support health in our community and surrounding areas. And one of the ways we do it is through information sessions and panels like this. So this is what we have today. Today we have a men's health panel, and we have two panelists, two physician panelists. We have Dr. James Kelly, urologist from Texas Health Mansfield. Dr. Kelly, please introduce yourself.
Sure, yeah. My name is James Kelly, urologist here in the Mansfield area with the Texas Center for Urology, affiliated over at the new Texas Health Mansfield Hospital. Have an office out there that I'm seeing patients and trying to help meet all of our men's health needs here in the area.
Excellent, excellent. Welcome. We also have Dr. Ankit Patel. Dr. Patel is a primary care sports medicine physician with the Arlington Physicians Network and also works with Baylor Scott & White Orthopedic and Spine.
Yes, good morning, everyone. Yeah, I'm Dr. Ankit Patel. I do primary care and sports medicine, and I'm affiliated with Baylor Orthopedic and Spine Hospital as well as Arlington Physicians Network. And I'm here joining the community to kind of see how we can help our men stay healthy.
Excellent, excellent. Well, again, thank you guys very much for joining us. So we'll kick this off. I'll start off with you, Dr. Patel.
Sounds good.
So we'll start off with just some general. So just general men's health, kind of what do you commonly see with specific to men's health? What are some common things you see and some common easy treatments related to men's health in general?
Right. So, mainly we focus on heart-related issues as well as diabetes, blood pressure, and then I'll leave the urological issues up to Dr. Kelly. But we do see a lot of prostate and erectile issues, which I'm sure he'll get into. But on my end, on the primary care side of things, our big focus is on reducing the risk of cardiac events as well as strokes. So we focus a lot on how to maintain a healthy lifestyle, which is diet, exercise. We also try to get everyone in to come do yearly examinations to make sure that their things like cholesterol, their blood pressure, and all of that is within the normal limits.
Very good.
Yeah.
No, with cholesterol, and we talked briefly before about this, and I read an article recently and talked about fatty liver disease and liver disease. I know in the past more alcohol related, but the fatty liver disease and cholesterol. And can you expand a little bit on fatty liver disease and what are you seeing and what are some options there?
Yeah, so we used to think that when you see liver disease, like you mentioned, that alcohol related. But now we're seeing a lot of what's called NASH or non-alcoholic steatohepatosis, fancy word for fatty liver. We're seeing a lot of that because of patients now being more obese, being overweight. A lot of our diet now is high saturated fats, high just volume in general, and that's causing the liver to have to work a little bit more than it should be. So we're seeing a lot of fat deposits and fat buildup around the liver, which causes fatty liver disease. So the way we try to combat that is we're trying to get people to reduce their caloric intake, try to increase their healthier foods, so high protein, low fat diets, and as well as to get out and exercise a little bit. We recommend 30 to 45 minutes of moderate intensity exercise 3 to 5 times a week.
Yes. Oh, no, very good. I just have to self-reflect a little there. So you hit on a little bit about the annual visit. So I think guys are probably the worst about seeing their doc. But what do you recommend for men at different age? What intervals should they see, and what should cause them to see a physician? Any concerns?
Definitely, yeah. So, we do see a big disparity in women versus men who come into the office. And usually when you see men, they say, oh, my wife or my significant other made me come in. But we're trying to get rid of that little stereotype slowly but surely. What we recommend is a yearly visit starting in the teenage years. Now, that generally is easy for men that are in adolescence, because when you're in high school or college, if you're doing athletics, you get your yearly exam when you do your sports physical. And then we sort of lose touch with men when it comes to age 20 to 35. We usually don't end up seeing very many, but we do recommend yearly physical even in that age group, especially for those who have different medical issues relating to either if somebody's overweight, if somebody's got comorbidities like blood pressure, diabetes, if there's a family history of any of those medical issues, then we want to get them into the office and make sure that they're on the healthy spectrum versus the unhealthy side. So that way we can prevent the long-term effects of different diseases.
So let's shift a little bit to the sports med, right?
Okay,
Sports med
yes.
fellowship. So specific to the men, maybe the weekend warriors, trying
Yes,
to pick that back up.
yep.
You're inspiring me. I need to work out more now. So what about keeping condition and preventing injuries?
So that's tough, especially if you stop doing it for a while. The weekend warrior, sometimes if you haven't worked out in a few months, you go out there and you say, hey, let me go run a mile or two. You get, the biggest things we see, shin splints. You just see muscle soreness in general for those who haven't done anything in a while. But the big key is if you are going to start trying to train or start trying to do some exercise, get into a healthy lifestyle, is we recommend start slow rather than, I know some people when they're in their 20s, you get used to running 2-3 miles a day. And then if you stop, we don't want you to go back into 2-3 miles. We say, hey, start at half a mile, start at a mile, or do a jog versus a run. So try to get your health slowly in the right direction. The other thing we recommend too is to see a physician before you start getting into training to make sure that you're healthy enough to start doing working out or weekend warrior type stuff, getting into athletics, that sort of thing.
Very good. I guess as we wrap this up, it's kind of general health maintenance tips, managing weight, managing just overall health. I know we hit on that a little bit, but anything else to kind of close on where just general health maintenance for
Yeah, so key points for men: 30 to 45 minutes of moderate intensity exercise 3 to 5 times a week. That includes cardio as well as resistance training. So that's weightlifting, that sort of thing. So we want to do all of that. And then we want to do on the food side, we want you to maintain a healthy diet as well. So, no Big Macs and fries and that sort of stuff. We want to try and stay towards the leaner meats and try to increase your protein intake and lower the carbohydrate intake. That's kind of the easiest kind of layman's way of trying to get into a healthy lifestyle.
I think all the things we know, but just getting there.
Right,
I like
exactly.
the tip also about just, if you haven't done it in a while, kind of transitioning, maybe consulting, making sure you're ready as you back up into.
Definitely.
Like
Yes.
Very good. Thank you.
Thank you.
Let's shift over to Dr. Kelly.
Yeah.
So urologist. So one of the big things come up when we talk about urology is prostate health.
Sure.
So I know we talked briefly before about it, but explain a little bit about prostate health, the screening,
Sure.
and kind of symptoms, treatments.
Yeah, absolutely. So prostate cancer can affect about 1 in 8 to 1 in 9 men during their lifetime. So this is a very common thing we see. And so what I usually recommend and what our societies all recommend is being screened for prostate cancer. There's obviously some things established for that. Typically men age 55 to 70, we recommend a annual PSA. It's a prostate cancer screening blood test, as well as a rectal exam, which I know most guys get all antsy about, but it's important. It's one of the few ways that we're able to detect this early and prevent it from becoming an issue long-term. The hard part about prostate cancer is there's not typically a lot of symptoms associated. So we're usually able to catch these a lot more times early on with screening with this PSA blood test, stands for prostate specific antigen, as well as doing these rectal exams, which again, Dr. Patel touched on. If you're getting these annual routine visits with your doctor, is something they can add in the mix as well. So it's not something you necessarily have to be seen by your urologist to get done. Some symptoms, things to look out for as far as prostate health goes, things that I see my fellows in the office routinely for, a slower stream of urine, noticing you're having to go more frequently, you're waking up at night more routinely. Sometimes when you're going, it's not very steady, starts and stops. You don't really feel empty when you're done. Those are all kind of typical symptoms we see of gentlemen whose prostate can be on the more enlarged side. The fancy doctor term we throw around is benign prostatic hyperplasia, which basically just means an enlarged prostate. As we age as men, our prostate grows with us. There's not really a lot we can do to prevent that. And so just being on the lookout for those symptoms and knowing this is something that's becoming an issue for me, that it's not something you just have to live with as you age. It's something we see very commonly, and it's very treatable. So.
Well, that's one thing I was going to hit on, BPH.
Sure.
So with that, again, there's always concern. So sometimes you see the symptoms more on, as you mentioned, is more on the BPH side, late signs on the prostate cancer side. So what are some of the treatments and I guess there's medication, different treatments for BPH?
Yeah, absolutely. So when I see gentlemen that have had these issues and have these concerns, and you're noticing these symptoms becoming more routine and bothersome in their life, we have a very large variety of treatment options, starting from, as you might expect, kind of non-invasive medication options that could just be you take a pill every day and, oh my gosh, I'm not waking up every night to pee all night long, and I can get my stream going a lot easier. And sometimes medicine's not quite there to fix it. We offer a lot of minimally invasive techniques and minimally invasive options where you come into the office and do your procedure, you go home that same day, no anesthesia, all the way up to, obviously, if your prostate's a little bit bigger than the average bear, maybe to where we have to do more of a surgical type approach. But the whole goal being to get our fellows where they can urinate without any trouble and get rid of all these bothersome, annoying symptoms that they don't have to live with.
I think it's an interesting thing that you said is that it's going to happen. It grows.
Yeah.
So it's something to expect. So there are some options, and don't ignore it. And we definitely don't want it to be anything worse.
Absolutely. And those are all things too that you can bring up to your primary care physician, and they can get you referrals to see someone like me, a urologist. But we're all here to help. And I always think it's something that most guys kind of kick down the curb thinking, it's just part of getting old, but it doesn't have to be.
So staying on that subject, you see it a lot in commercials. Maybe it says I'm watching news or something, right. But a lot of all the over-the-counter medications related to prostate and different things like that. What's your experience with some of the over-the-counter stuff?
Sure. So a fair amount of those you'll see will have things like saw palmetto and other things that are added in these super beta prostate. There's all kinds of these over-the-counter options. The hard part with those is most of them aren't FDA approved, and there's a lot of data that says that they may or may not really show much improvement in your symptoms. So I'm usually the guy who says, if you feel like it's helping you and you're happy with it, go for it. But I can't show you any data that really tells you that it's really going to help you. And we have a lot of medicines that I use very routinely with pretty minimal side effect profiles that will get guys feeling a lot better, that I could say, hey, here's this prescription that I know works. So I usually recommend, if you have seen your doctor, the ones that I would prescribe would probably be a little bit better, and we at least have some data to back it up in comparison to some of these more over-the-counter prostate type medications.
Gotcha. And then there's probably more monitoring that can go on as you
absolutely.
work on that.
Absolutely. We do all kinds of different urinary tests and studies, questionnaires to monitor, to show the improvement that you're getting from either these medicines or procedures that we're looking at doing.
Well, we're good. All right. So here talking to urologists and men's health, we will address the elephant in the room.
There you go.
Good cholesterol, bad cholesterol levels.
Right.
No, I was joking. No, erectile dysfunction.
Yeah.
Or actually, I know we talked briefly, and you called it erection quality. You were really pushing on that piece.
Sure.
But so what kind of expect there? I mean, when is it a concern? Actually, we know when it's a concern. Right. What's a sign?
Every man's concern, right?
No, but
always a concern.
But when should they reach out and talk to their doctor about
absolutely.
that? And what are some options there?
Yeah, I think kind of similar to what I was touching on with the BPH. I think a lot of the gentlemen I see that are going through this think that it's just something that comes along with as I get older. There's nothing I can do about it. Can't be intimate anymore with your partner. And it doesn't have to be that way. Typical symptoms, as you'll notice, maybe, and we can touch on this a little bit too, because there's some testosterone issues at play as well, but maybe the lack of the libido or sex drive can be at play. And then on top of that, as we age, you can imagine your blood flow to different areas might not be as great as it used to, going hand in hand with what Dr. Patel mentioned with our cholesterol issues or diabetes or things like that. They all affect our erection quality as men. So it's not necessarily that you quote unquote can't get it up at all. It's really even the quality factor of, can you have that erection and maintain your erection, and at least to where it's satisfying for you and your partner. And again, it's not something that has to be lived with. These are things that we can treat very simply and very easily. Again, ranging from things as non-invasive as a medication, all the way up to procedures, things that I can do to get my gentleman back to where they can have a satisfying love life and not feel like this is something that they're missing out on because they have to, because they don't. We have ways that we can get them better.
I think that's the key thing, both when you're talking about with erection quality, but also the prostate, is it's not ignoring it. Some of it's to be expected. It's not a bad thing to be, but that there are options to manage that.
Yeah, and I know we're all guilty of it as men, just like you just mentioned, not going to see our doctor, kicking things down the line. But these are very common things that we see routinely, things that are typically very treatable, sometimes as easy with just a little medication. So that's always a big point I try to make, is you're not alone in this. This is something I see specifically every day, multiple times a day, that we get guys back to having satisfying love lives or urinary symptoms on that matter.
No, very good, very good. Well, you hit on this just a little bit, but I also want to talk about testosterone.
Absolutely.
So you talked about how that obviously impacts with ED, but also just general. I guess you always hear the low T center and the different things So with the testosterone decreasing, so what's normal there?
Yeah.
What are some signs and symptoms, and what are some options there?
Yeah, absolutely. So men, as we age, we kind of go through a peak in our testosterone levels, typically in your early to mid 20s, kind of up to about 30 years old. Once you're at that point, that's kind of your maximum testosterone that you're able to produce. And it honestly only goes down from there as we age. Symptoms that we typically see with the low testosterone, reasons to kind of either look to see a urologist or reach out to your primary care doctor, things like low energy levels as a man, unintentional weight gain, losing muscle mass that you typically had that you never really had to work to keep up, lowered sex drive. All those go pretty hand in hand with our testosterone levels of men starting to decrease. And it's not just necessarily a symptom issue. As your testosterone gets lower and lower, it can affect lots of other issues like your heart health, your bone health. It's important to have this testosterone in our bodies functioning. And so when we see patients for this, I do a pretty thorough workup, because I think a lot of factors are at play. There's a lot of different hormone balances and a lot of things that can affect our testosterone level as men too. And so whenever I see patients, we check a bunch of different hormonal labs and panels, get a good thorough history, and what we can decide on at that point is if there would be a benefit of, boosting that testosterone somehow, either with testosterone replacement or even some other medications that allow us to tweak that hormonal balance in men as well. And most of our fellows, when we get them back on this track, they're amazed at just how fatigued and how worn down they were. They thought they were a little bit, worn down, and then we start them on something like this, and they're feeling like they were when they were in their late 20s, early 30s, because their energy's back. They can get out and do these exercises, get this 30 to 45 minutes several times a week. So it's something, again, that I think most fellows forget about and don't think about, and just think it's part of the aging process, which it is, but it's also something that we can help and fix.
So is it more with when there's issues, or is there normal intervals for screening as we age for that?
So typically a normal testosterone is actually a very wide range. So one gentleman's normal testosterone might actually be another's pretty low. The typical range is kind of a 300 to 800 or 900 level. So I usually base a lot of mine on your symptoms, because even to consider a treatment, I like to make sure that we have the lower level, but I want to make sure it's bothering the patient, because we don't necessarily need to replace it. If they're feeling good, have a good, healthy libido, have good energy levels, they may not need more testosterone.
Gotcha. All right. So basically my testosterone level is going lower. Prostate's getting larger. Any good news here for the men? As we're getting older, I'm checking all this stuff.
Oh my gosh, we get wiser right here.
We'll see. Well, no, that was good discussion there. So as we close to wrapping up, just general urology health related to men that just want to close on?
Sure. I think the biggest things that I encourage all my gentlemen we've kind of touched a little bit on is just an annual visit, whether it's with me or your primary doctor, to be screened for prostate cancer. I think it's very easy to not want to go in and have that, exam done or not go be seen by your doctor. But it's really sad to see the fellows that missed it come see me way later in the game, and there's not as much things I can offer for them compared to when we could have screened them a lot earlier. Again, when you're asymptomatic, don't have any symptoms, recommend starting that around the age of 50, or other gentlemen that are at higher risk factors, like if you had family history, African-American, or a smoker, we start even earlier on that screening. I think that's a big thing. And then the other just key takeaway is knowing that these don't have to be things that you live with your whole life. We have options and things to treat our fellows to get them back feeling better and doing better in life.
No, very good, very good. Dr. Patel, anything else to close on as we wrap up the men's panel?
I think, we hit a lot of things, but like Dr. Kelly was mentioning, to get into the doctor, whether it's a primary care, whether it's urology, make sure you get seen once a year. We can get all the screenings done. We can do blood work. We can make sure that you're doing everything that way we can prevent these future things from happening or being as bad in the future if they do occur. We have a lot more treatment options if we catch things early rather than later. And the big thing is just be out there, stay healthy, and just work at it.
Excellent. Excellent. Very good. Very good. Well, Dr. Kelly, Dr. Patel, I'd like to thank you very much for participating in the panel discussion. I know we have more questions that we'll have here in a few minutes for the audience, but I really appreciate you guys taking the time.
Thank you.
Thanks for having me.
Thank you, guys.
Absolutely. And on behalf of the Healthcare Council and the Chamber, I'm glad that you guys participated, and keep your eyes out for updated monthly information coming from the Healthcare Council.
Great. Thank you.
Thank you.